Good morning, good afternoon, everybody. My name is Rach Slater, and I'm going to be facilitating today as we have our session focused on localization. I'm going to be guiding us through the webinar. I'd like to thank you all for joining us, and particularly to socialprotection.org for hosting us. So I want to start off first by flagging why are we here and what is today's webinar about. I guess our starting point is simply that term, localization. Now, as a social protection researcher, it doesn't mean much to me, but it seems to mean a lot to people on the humanitarian side. And there are commitments to it, for example, in the 2016 Grand Bargain. My colleague Paul's flagged to me that even on the humanitarian side, it's not always clear cut. Humanitarians don't always agree on exactly what it means, and they've been arguing internally about it for about the last decade. So then linking across to social protection is even harder still. If we look at the ECHO definition, localization means empowering local responders in affected countries to lead and deliver humanitarian aid. I'm left thinking, oh, okay, that's not really got anything to do with me. I don't work on humanitarian aid. And it's also tricky because for me, and I think for many of us, social protection's fundamentally premised around supporting national systems and respecting national ownership and national leadership of social protection. If we try and look back the other way at social protection into humanitarian, I also found it odd that there's a whole set of language that we use in social protection to talk about how it's designed and delivered across different levels. So words like decentralization, devolution, de-administration, deconcentration, all of these words seem to me to pick up on ideas that are folded into the term localization, but they don't seem to be used at all by humanitarians. And so what happens? Well, we all end up talking past one another. So having this webinar is for us a first attempt to try and start a conversation that enable us to understand each other a bit better. So some of what we might want to think about during the webinar is about definitions and terms. What are we really talking about when we talk about local actors? Is it national NGOs? Is it wider civil society? Is it governments? Is it all of those things at the local level? And I think perhaps we mean different things across social protection and humanitarian sectors when we talk about specific people or actors. Another part, the second part of what we really want to think about is what are the particular challenges or maybe even the opportunities for localization during wars when governments may be parties to conflict, when civil society can be constrained and fragmented, but when there may be opportunities to work locally when you can't work nationally. And then finally, a third thing to consider is around practical issues. So if we agree on the goal of more effective and direct support to local actors, what tools do we have to make that happen? And what part can social protection play in that when humanitarians are trying to work locally? So now I've introduced the topic, let's move on to a couple of housekeeping things. So next slide, please. The first thing to remember is that the session is being recorded. We'll share links and resources after the webinar. People will be able to watch it or listen to it online. So just bear that in mind when you're sharing information and when you're responding. The second thing is that we'd like you to use both the chat box and the Q&A box today. So the chat box, use it to introduce yourself, to say hello, to share resources, to add a link to a report or some information. If you want to ask a question, please do that in the Q&A box. And remember to be specific. So don't say something like, that's a good point about X, but what about Y? Because by the time we get to your question, I will have forgotten what was actually being said by our speakers at the point when you wrote your question. So do be as specific as you can be. And then finally, when we get to the end of the webinar, there will be a questionnaire that will open automatically for you to respond to. And we'd really, really like your feedback. Next slide, please. In terms of timing, we're going to hear from three people today. We're going to have a presentation from Abeer, Al-Absi. She's going to talk for about 15 minutes, and then we'll have our colleagues George Kamau and Paul Harvey coming in as discussants for around 5 minutes each. That will leave us with about 20 minutes for questions and a little bit of time to close. So let's introduce our speakers. If we move on to the next slide, thank you. So Abeer Al-Absi is a consultant with STAAR and BASIC Research, two funded programs of the FCDO. She specialises in social protection, humanitarian assistance, and localisation in crisis settings. And she's contributed to research and evaluations for WFP, FCDO, IDS, ACAPS Yemen, SDC, and other UN agencies. And she works specifically on strengthening locally led responses, assessing social assistance programs, and advancing inclusive humanitarian strategies in Yemen. Next up, we'll have some responses from George Kamau, who's a research and data management specialist with experience in both humanitarian and development contexts, and he currently works at the Share Trust as a research lead. He's implementing a STAAR study on strengthening the role of local actors in social protection, with a focus on gender equality and social inclusion outcomes, and in crisis contexts. He works across 6 countries, so Kenya, Myanmar, Lebanon, Nepal, Sudan, and Afghanistan, and hopefully he will be able to reflect back to us from those countries on what Abeer has told us about. And then finally, Paul Harvey is a partner with Humanitarian Outcomes and a co-director of BASIC Research. He's done a lot of work on humanitarian cash and how it and when it intersects with social protection. So if we move on to the next slide, please, I will open the floor to Abeer. Abeer, I'll come off camera and give you a quick wave when you've got 5 minutes to go and then when you've got a minute to go. So thanks, Abeer. Over to you.
Thank you. I'm really happy to be with you in this seminar, and it's talk about a very important subject about localization and social assistance. The research that we did under the BASIC research project, the Sustaining Yemen Capacities for Social Assistance, Lessons from a Decade of War. I co-authored this a research along with my colleague Paul Harvey and Becky Carter. Next slide, please. Well, Yemen. Yemen is one of the worst crises in the world. It's a protracted crisis, one of the humanitarian crises that most of the donor international organizations try to intervene since 2015 until now. The country witnessed a lot of kind of complexity, mix of humanitarian and development intervention. Yemen, before even the war that started in 2015, was one of the poorest countries in the Middle East that was classified as a fragile state. The war has really impacted in the life of the people and also resulted in different waves, several waves of displacement from the areas that has been hit by the airstrike or has been also affected by the internal conflict. What happened starting from 2015? Before 2015, there was kind of, let's say, a system of the social protection in Yemen. This system was started in 1996. And that was kind of 2 main actors, national organizations, who were really tackling the issue of social protection. Social Welfare Fund, this governmental organization, was mainly tackled the issue of the unconditional transfer fund for the most poor people in the country. The other one was or still is the Social Fund for Development, and it is kind of parastatal organization that before the war was mainly focused in development. What happened after the war to this system? Starting 2015, the project was suspended. The project of the Unconditional Transfer Fund for the SWF was suspended. And then World Bank start to do this project with implementing partner, which is the UNICEF. That program started to resume in 2017. And then in 2020, UNICEF started also to include Social Fund for Development as an implementing partner to them. And that was starting off maintaining this kind of capacity to the national organization that is tackling the social protection in Yemen. But what happened to the beneficiary list? SWF was the main organization, as I told you, for the unconditional transfer program. And by 2014, that was a list of 1.5 million beneficiaries. Starting from 2017, the list being used, the same list that was last updated in 2014. Until just recently, until the last cycle was January this year, and now there is a new kind of restructuring of the program and a new kind of retargeting. But the list is still there for 10 years, the same beneficiaries for 10 years. However, that was a kind of different changes in the status of those people. What happened to SWF in this regard? SWF started to be like under the Social Fund for Development, and Social Fund for Development to implement the social protection program, they contracted individual from SWF because they are the one who hold this kind of list, and they are the one who has this relationship with the communities because they were the main national institution for unconditional transfer fund. In Yemen, there are many challenges that facing partners who are working in social protection. Social protection, as you know, it's about the national system. The country, after hit by the war that broke out in 2015, has been kind of split into two. So we do have the internationally recognized government in Aden, and we do have the de facto authority in Sana'a. This kind of division also impact negatively the social protection system, whereby social welfare fund, as they are the governmental body for the social protection, has been divided also under this kind of governmental divided. So there is now a headquarter of SWF in Aden and a headquarter in Sana'a. And that really complicated things because now, although we are still one state, Yemen is still one unified state, but you have this kind of contested governance system. Aid also restriction, a kind of putting a lot of challenges in front of the donors and the humanitarian partners to do this kind of good support to the social protection system. Also the restriction, especially putting in the north by the de facto authority, hinder the work and hinder to reach the most poor people in the ground, and also capture of the aid, because it's, as I told you, is kind of contested governance. It's protracted crises. We were, even before the war, it was a fragile state. Also, data collection is become kind of headache on the humanitarian aid system. To do kind of data collection, they will put a lot of kind of challenges in front of the humanitarian aid, so that they cannot go and verify, validate, or do this kind of validation of the list, or do this kind of also field visits, monitoring and evaluation, so on and so forth. All this kind of constraints really hinder the work to be effective and efficient to the best of the Yemeni people. Beside the World Bank funded unconditional cash transfer, there is also the WFP General Food Assistance. By 2022, the WFP General Food Assistance, it was over $1 billion. And also the beneficiary was over 13 million people. The list of WFP is also kind of old list. The last update of the a list was 2018, and now they are currently doing retargeting to also review their program. For the World Bank funded unconditional cash transfer, the funding by 2023 is $150 million. And there is kind of differences in the dietary needs. So for WFP, it started in the beginning of the crisis, it was like 80% and down to 41%. And we are waiting to see what will be the new change in the WFP program. For the World Bank, they keep the list of the beneficiaries and they keep the transfer value. And it's only for 10%. Next slide, please. Well, what happened to Yemeni capacities in a decade of war? To do the research, we did kind of field visit to both SWF and SFT, and we met around 100 staff from both. What we found that has been built very good payment system in place, call centers with a very qualified cadre that they have this kind of protocol in place, the monitoring system as well, reporting, safeguarding capacity, and unfortunately business like NGO. And also the system of SFD. For the business like NGOs, what we found that unfortunately, under these kind of assistance, the international organization deal with the NGOs as a services provider. That wasn't kind of a good capacity building, institutional building for those NGOs, so that they can, after things become calm and we can go to kind of national social system, they can continue the work. Unfortunately, this kind of capacity wasn't there. And as I told you, they were only, as a services provider, deal with them as a contractor. And that really hindered the localization. It's not only about transfer budget to local NGOs, it's beyond that. It's about having this kind of a strong national organization who can work in social protection in a very efficient and effective way. SFD is one of the bucket of effectiveness. The system in place in SFD has been built even before the war by the World Bank and other also international organization. The good thing that SFD kept their neutrality over the period of the war, because they are a semi-governmental organization whereby they report directly to the Prime Minister. They are not under the Ministry of Social Affairs. This kind of neutrality and having one headquarter give this kind of flexibility to SFD to expand and to also build the system. What's not being built or maintained? The SWF system and the cadre of professional social workers. Unfortunately, SWF system has been paused. Old devices, old management system, and also the cadre of professional social workers. I met some of them, and I was really disappointed about the fact that they have a very tense kind of experience in how to do this kind of social work, how to target to the community, how to deal with the cases of people with disabilities, how also to know how to target women, so on and so forth. And what I found that some of them, especially the ones who are in the northern area, whereby there is no kind of regular salaries paid to them, some of them, they started to shift to another work, like taxi drivers. Some of women started their own small business. And I found a lot of cases that they felt themselves lost, and they couldn't even find food for themselves and for their family to sustain themselves. Their capacity also, they feel that because there's been kind of suspension of the work, they feel their mind need now to have a lot of refreshment training so that they can restore all the skills that has been undermined because of the suspension of SWF work. Some of them has been contracted individually under the USTB implemented by SFD as a consultant. SFD has this kind of objective to also help in rebuilding the capacity of SWF. But that opportunity wasn't offered to all the staff of SWF, but to some extent to a small number of it. Also, the capacities to target wasn't there. As I told you, there is kind of old lists held by UST program and also WFP program. Before the war, that was kind of annual review of the list. Always there is kind of having this kind of field visit from the social workers of the SWF to the beneficiary households, so that they are having this kind of reviewing the list, who can be in, who can be out, how also they replace the cases that are not anymore need to this assistant.
Hi, Abeer. I'm so sorry to interrupt you. I wonder if I could ask you to take one more minute to just go over the final wider emerging themes in just a final minute for me, please. Thank you.
Thank you. For the wider emerging themes, focusing on maintaining and strengthening capacity at the local level is really essential. So that we have this kind of decentralization of the social protection, look beyond the narrow technical focus and consider a broader spectrum of institutional and organization capacities. And this is really the aiming of having localization. The aiming of having localization is to have a strong kind of national social protection system. And think about social workers, not just payment. We do have many number of social workers well experienced, and they don't even have an opportunity to get a work and to get involved in this kind of work of the social protection in Yemen. Thank you, and I hope that didn't exceed the 1 minute. Thank you.
Brilliantly done, Abeer. Thank you so much. I think the big takeaway message from me listening to Abeer really boils down to avoiding using local actors just as service providers and recognizing that they have a much bigger role to play. And I was also really taken by the notion of being a neutral local actor. And I wondered whether we have the capability to identify neutrality or not. And do we need to do better in our analysis of institutional politics or the political allegiances of organizations to help us figure that out? So maybe you could react to that in the chat box, or you could ask your own questions about the different roles that we might envisage for local actors. With that, we're going to move on to hear some reflections from George, who I think is going to draw in some of the findings from his work across 6 countries, as previously mentioned. I'll give you a 1 minute wave, George.
Thank you. Yeah, and thank you so much. And just drawing from Abeer's presentation, and also getting it from where Rachel has said in terms of like local actors, we need to start recognizing them as playing a bigger role rather than just being service providers. And the study that the Shared Trust has conducted on the role of local actors in social protection, not only looking at what are their roles, but also trying to understand the opportunities for strengthening their role and their potential role, and also looking at what are the barriers in terms of strengthening their role in social protection. So yeah, so this research we are actually synthesizing the results, and probably be able to have this by the end of this month. And just to reflect in terms of what we are finding, because we looked at local actors in terms of two levels. We had looked at the government actors and also non-government actors, thinking about community structures, for instance, self-help groups, community-based organizations, and also the local CSOs, and which mostly when local actors are being defined, we normally think around the lines of just national NGOs. So looking at local CSOs, which are normally called the national NGOs, also the private sector companies in terms of what is their role and what are also their potential role in social protection. And this study looked into 6 different countries, but then again we had also a concentration on 4 crisis contexts, that is Afghanistan, Sudan, Myanmar, and Lebanon. And we are actually finding in terms of the potential for local actors. And one of the questions that we were asking in our studies about what is the perception of international actors in terms of what do they think are the potential roles of these local actors in program framing, program design, delivery, and monitoring? And we found that local actors are demonstrating quite a lot of potential, not just being used as service delivery, but then including grassroots organizations, especially in Sudan. We are seeing grassroots organizations demonstrating and saying that they have potential to be co-responsible or take leading roles in design and framing of social protection programs. But then, of course, there are some hindrances in terms of capacity or even the perception. And what was coming out was the differences between the perception of international actors and the perception of the local actors in terms of their own potential in social protection. And of course, there were also some emerging challenges that was coming out. And I think in terms of this crisis context, of course, lack of established national social protection systems, or some of them had stopped working or suspended. And then there is a lot of reliance on international actors' social protection programs, in as much as social protection system should be government-led, but then due to this fragmented governance, contested government system, for instance, in Sudan, with several authorities, in Myanmar, with 2 sides opposing governments, the operating environment becomes a little bit difficult for most of the local actors. In some of these contexts, local CSOs are needed to register with the military government and seek prior approval, funding, in partnership and things. And then they feel like there is no independence to freely operate. And there is also, in terms of capacity gaps for local CSOs, especially the grassroots actors and also local CSOs, in terms of understanding social protection practices, and especially on gender and social inclusion. So those are some of the things that are coming out. And also in terms of another key barrier that was coming out was in terms of short-term funding circles for local actors, not having the fund to strengthen their own systems and strengthen their own capacities, barely being funded only to conduct the activities. So those are some of the things that are actually coming out from this study, and we're actually synthesizing that, and actually it is speaking very much well to what Abeer has been presenting. So those are my thoughts. Thank you.
Super. Thanks very much, George. I mean, as well as picking up for us again on the question of being more than service providers, I think the other thing that comes out for me is the way that we think about local capacities, about whether we're thinking about it in the right way, whether there are biases in the way that we think about local capacities, and maybe that's something we can try and unpick in the discussion. But before we turn to the discussion, can I introduce Paul again, who's going to talk to us for 5 minutes with his reflections, and maybe explain that he also lives in a fragile country that has an appalling railway system, and that means he's going to have to be risk averse and leave us a little bit earlier. Perhaps you could explain that for us too, Paul.
Sure, yeah, and I have to go and jump in a taxi to make it to the airport in exactly 16 minutes time, so I will not talk for 5 minutes. I'll talk for a bit shorter, and apologies for having to leave a bit early. As Ray started with this, localization I've always found a sort of odd term, even though I mostly work on humanitarian issues, and I find the way in which it's talked about by humanitarian actors really frustrating, because although most definitions of localization are quite broad, and local and national actors in ways that can include governments, in practice, when humanitarians talk about localization, it often boils down to how international aid agencies and donors fund national NGOs, and whether they're doing that as directly and effectively as they could. And that's clearly an important part of the question. The really big organizations like WFP and UNICEF, which amount to an increasingly high proportion of aid delivery in fragile and conflict-affected places, don't actually do the implementation work themselves. They subcontract NGOs to do it, and they subcontract those NGOs on really lousy terms, and those NGOs don't receive enough direct support, and so don't have core funding to enable them to grow as organizations. And that's a big problem. But it's only part of the problem of localization. So if you define local and national actors as the sort of interplay between governments and civil societies in places, and you think about how assistance can be delivered in terms of the sort of interplay between social protection systems and what government was doing before conflict broke out to provide people with pensions or child benefits or cash payments for the poorest, and humanitarian aid, which has stepped in when government capacities have been overwhelmed, then localization is a much bigger, more interesting question about the extent to which you can support or maintain social protection systems, and the extent to which government is still responding to the needs of its citizens and its duty to protect and assist its own citizens, and then the role that civil society plays in holding government to account, and where international aid fits into all of that. And that's, I think, much more interesting and much more complicated, but kind of so often gets missed in debates about localization. And so when we're doing research as BASIC on looking at the what is happening to social protection systems in conflicts, we're interested in the extent to which those systems are being maintained or supported or able to survive through wars, what happens to the workforce as well as the systems, and trying to get beyond this sort of narrow technical focus on how we deliver money to people and which organizations do that, to a slightly broader look at what is happening to social protection systems, what that means for how people can be assisted and supported. And that's where I think it would be nice to see the localization debate moving, but I'm not seeing a huge amount of that happening at the moment. That's kind of it from me. Let's open up, Rach, for people to chip in.
Okay, thanks, Paul. I think it's interesting, isn't it, that humanitarians are good at tracking what happens to humanitarian workers in situations of crisis, but none of us are very good at tracking what happens to social workers or social protection workers who are on that front line, who are working at a local level. And so it's strange because we clearly have the capacity to reflect on what happens to workforces, but we're not doing it for the social protection workforce. So I think that's another thing. Maybe people could start popping some questions about this into the chat box. I think we've heard about not just being service providers. I wonder if we've got more questions about what the other ways are that we can work locally. We've had a set of questions that have been about the kinds of capacities that we need to work more effectively at local level. And I've got a bunch of queries about what those capacities really are, because I think they're probably not technical skills. And then, do we need to make sure that we look beyond local NGOs and try and look at other actors at that local level? We've got one question in the chat box already that I'm going to pose to our speakers. And then we'll hope that you're going to post some more questions, or I'll start posing some to the panel. So if we could start by looking at Sarah's question in the chat box. Was the role of a strengthened payment system, if any, in enabling localization? I wonder if we could direct that. We'll perhaps go in reverse order. So to Paul first, and then George, and then to Abeer.
Sure. I was just going to have a first crack at it. So, I mean, this in Yemen, the program that Abeer was talking about, that the World Bank funded, in part UNICEF implemented, there was this pre-war database that gave cash transfers to 1.5 million people through SWF. That was kind of suspended and then transferred, because the World Bank couldn't directly fund the government of Yemen anymore. That they did a contract with UNICEF as a third-party implementer. UNICEF put up a project implementation unit in Amman to sort of build a payment system and enable payments to be resumed to 1.5 million people. And that's now carried on for many years. Over the course of time, UNICEF has had the ambition to hand that back to a national actor. And so they've been working with SFD to try and strengthen its payment systems to be able to take on more responsibility for that, although that's been interrupted by the sort of political events over the last year. And so clearly a functioning system by which national actors can deliver payments, and that can satisfy the sort of diligence and contracting requirements and safeguarding requirements, all the other requirements of international donor agencies, is an important part of local capacities to deliver assistance. And that's the sense in which payment systems are about localization. But the point we were making in the Yemen research is that it's only part of the answer. And there's been a tendency, I think, both in the sort of humanitarian cash and social protection debates to focus on how we get money to people, which is an important part of it, but isn't the only part of social protection, which is ideally a sort of wider enterprise in terms of sort of identifying and supporting people that are particularly vulnerable.
Thanks so much, Paul. Any reactions from George or from Abeer on strengthened payment systems?
Nothing to add on my end. I think just agreeing with what Paul have mentioned.
Yeah, I
Thanks.
echo what Paul mentioned. Yes.
There was
Thanks.
a really
I mean, one of the things that occurred to me while Paul was talking was thinking about the use of point of sale devices in northern Kenya that are used so that mobile populations can collect cash transfers anywhere they want. The reason that I flag it is not really about the mobility aspect of it. It's that we have to remember that markets and trade and commerce still happen, even in conflict-affected places. And there must be ways in which localized payment systems help to trigger, sustain, support markets, and perhaps support liquidity as well. And perhaps that's something that we should pay a bit more attention to in conflict-affected settings. Paul.
Yeah, I should probably hand the Sudan question to George, but I was going to sort of seg between the two. One of the really interesting things Abeer found in Yemen was a contrast between people who ended up being employed by sort of UNICEF, SFD, and others who were sort of bright young things who were good at managing databases and payment systems and spoke good English and therefore could report to donors. And the people who weren't being paid, whose jobs were atrophying, who were struggling to get by, were the older social workers with decades of experience, but who didn't speak English and didn't sort of work in the international aid system processes. And that was very familiar because I remember it from Kosovo, where I worked when I was still an aid worker, and where we were employing a bunch of 20-somethings who spoke good English and not letting atrophy all sorts of brilliant people who had much more experience but didn't speak English. And someone was just telling me a similar thing is happening in Ukraine as I was doing interviews for a World Bank study there. And that saves into the Sudan question, I think, because the system is incredibly bad at respecting the ways in which national actors, whether government or civil society, can report, are accountable, are embedded, and finding ways for us to adapt our systems to enable us to support them better. And instead demanding they become more like us, and so you get these very business-like NGOs that are set up to sort of to take advantage of a huge market, because aid has become very big business, or that's about to become much smaller business. But over to you, George, for more on Sudan.
Exactly, and I think it's that question on the challenge on the funding ERS in terms of accountability to donors, right? Yeah. So yeah, and I think one of the things we are seeing not only in Sudan, but also this one was reported actually in Myanmar, is that there is, a lot of accountability requirements from the donors, and then this actually inhibits or prohibits the especially grassroots actors to be able to to play any good functions. And one of the recommendations, especially from the local actors, was that this needs to be at least lessened in terms of all these, donor requirements, accountability, and all that. And of course, for the emergency response rooms, what we are finding out is that most of these systems were formed by, and the funding was coming mostly from, people from the diaspora and all that. But then, in terms of now funding them from, these regular donors or international actors, then the accountability systems that are required are actually a hindrance. And it was one of the challenges that was mentioned across these three contexts that we studied. And there is actually need in terms of when you think about localization, it's not only about the funding, but also thinking about what are their capacities and what can they be able to deliver and to do, and also probably building their capacity if there is need of some of these requirements to be done, and also lessening them a bit. So that is what was coming out from the study, but not only from Sudan, but also across the three contexts that we looked at.
Thanks, George. Abeer, have you got anything to add at this point, or shall I keep us moving?
Yes, I think also another dimension, we forgot to talk about it under also the localization, is the role also of the local authorities. Yani, for instance, in Yemen, we do have this kind of governance system whereby you do have local councils. Local councils are under the district level, and they are the one who are really attached to the community, who used to be doing this kind of plan and budget. And when the partners come to do this kind of social protection, they just use this kind of local council for two things. Number one is just to stamp on the list that they are happy with the names of the people has been selected by this district. Second one is if there is any dispute happened within the community, they will go back to the local council. That really undermine the capacities also of the local authority. And for social protection, you need also to have this kind of centralization and work with also the local actors. So it's really also important to have all this kind of system all together.
Bye all, I've got to run. Huge apologies. Got to take my son somewhere. Bye all.
Good luck. Bye-bye.
It's become a thing in the UK in recent years that you cannot depend on a train anymore. So yeah, fragile transport system, I think we'll call it. So I think one of the things that I'd like to pick up on in the absence of further questions in the chat box is this question of capacity. And George, you were flagging the assumptions that people make about capacities, both about international actors' capacity and about local actors' capacity. I wonder if I could press both of you to tell us a bit more about the assumptions we have about capacity, but also what we find in the real world on the ground if we try and look at this through a more objective set of capacity lenses or glasses. Abeer, could I ask you to tell us a bit more about that? I know you and I are really interested in that distinction between technical hard skills and softer interpersonal skills and how important they are in situations of conflict.
In fact, there is kind of inequality in targeting national and local NGOs. And that's why we find also this kind of differences in the level of the capacities, at both the level, especially the technical capacities. Yani, for instance, at the national level, some of those big national level who get the opportunity to be partner with UN agencies and other international organizations, they got this kind of support via their core fund to do this training for their staff, to leverage them for the technical skills. And also they build themselves in it for their institutional building. Also, they put a lot of resources. But having said that, then every single international partner will come and find out where are those big ones. because it's easy to access them and it's easy to work with them. They have good English, good system in place because they have the resources to do so. For the smaller one, they have the technical capacity because they really have this kind of technical knowledge about how to do things. And they are also, the advantages of them, they are attached to the grassroots. They know the communities, they know the local actors, they know the culture, they know the context, and they are the one who can do that. Unfortunately, because they don't have this kind of, from the point of view of the actors, the international actors, they don't have this kind of the system in place to support them. So they always this kind of imbalance between both national and local, whereby it also, from all the work that I have been doing so far since the outbreak of war until now, I found that also led to having this kind of exclusion of the most vulnerable groups and not being able to involve them in the social assistance programs in a good way. So yeah.
Thanks so much, Abeer. George, any reflections from you around capacity?
Yeah, exactly. And I think one of the biggest assumptions is that capacity is only in terms of skills, and also the assumption that who defines this capacity? And that's the question that begs in my mind. When you talk about capacities of these local actors, and I was looking at, especially from our findings in terms of the grassroots organizations, self-help groups, and mentioning that they have the potential to lead in some of these social protection programming, but then the international actors are saying, no, you can only be consulted in this and this areas. But then in terms of who defines this capacity, because as Abeer has mentioned, some of these, especially grassroots organizations, they have local knowledge, they know how to navigate local dynamics and all that. And I think they are very much well able in terms of some of the capacities as defined, in terms of these organic societies. But then for me, the biggest challenge and the assumption is, who defines these local capacities? When you talk about local capacities, or do you define, when you talk about skills and all that are required, are they defined at the same way at these grassroots and local levels? And this is a big question that, that begs to be answered.
Thanks so much. I think from the work that I've been doing in Syria, and particularly in northeast Syria, there are really, really good examples of the importance of a set of personal and operational skills that are not really about social protection itself or humanitarian, but are about how you engage with the community, how you navigate a security checkpoint or deal with a very aggressive military actor when you're a social protection worker trying to reach people to register them for a program. And then there's also a set of skills around consultation that seem really difficult to navigate when, for example, you might have different religious groups or factions within a particular community, some of which have been excluded, some of which have complained that they've been excluded from a subsidy program or something. And one of the things that we're finding is that we underestimate the importance of those types of skills, and we just resort to training, knowledge, learning from internationally. And we forget to really grasp all of that local knowledge and experience that enables people to operate in the real world. So really similar things that we've been finding in northeast Syria too. Sarah's turned Vincent's query into a question and asked, could the expansion of group cash transfers offer ways that we can leverage and build up local capacities? Or is that just something that we're doing because we push it as a paradigm from a donor perspective? What do we think about more group focused social protection or humanitarian transfers? George, can I come to you first on that one?
Yeah, and I think the question about group cash transfers, and I know there have been a lot of terminologies here about providing micro grants, probably to groups. And I think one of the issues that I'll mention is that sometimes, especially these group cash transfers, they are normally defined to already established and kind of formal groups. If you're thinking about village savings and loan association or self-help groups, and then like you try to channel this funding through them, and most of them is normally in terms of probably trying to tick programmatic boxes and all that. But one of the lessons I've been learning from Somalia, because we have another program that we are running in Somalia, is that there is also an opportunity of thinking of very much deep informal groups in very, very deep areas. They don't even have any of organization. They are not formal, but they normally do some things in their community. And most of these groups, they have social affinity. They know each other and all that. And I think that is the myth about group cash transfer. But I do agree that they can be a very good source of strengthening social capacities. But again, how are they defined and how are they programmed? Is it only thinking about these formalized and known groups, or do we think about deeper organic groups and maybe informal associations in the community that can be strengthened? So that is what I would say about that.
Sorry, I was muted. Since I've asked you the question pitched by Sarah, we've also had Vincent restate it, and he's asking something very similar to what you just responded. What about all of those community support mechanisms that, we can argue for 100 years about whether we define them as being part of social protection or not, but they are there. They are key ways in which people sustain their households and sustain their consumption. We all depend on those kinds of local networks. Abeer, are there things that we can do to tap in better to them, or at least stop ignoring them when we're doing our programming?
Yeah, I'll give you some background from Yemen on this. It's very important, but it has been overlooked by the humanitarian system, the informal one. Yemen is a tribal system. So this kind of tribal system, it's really articulate this kind of social contract among the members of the tribes. Yani, for instance, we do have like law for each tribe. This law, by this law, if for instance, I have like need to cash for health disaster, for education, for my son to travel to Saudi to work, the tribe will come all together and they will share for me money to do so. It's mandatory. It's mandatory by the law of the tribe. No one is talking about this kind of norms and informal setting that could embedded in the system. And go to what George said about the FSLA, for instance. Now there are some work in FSLA, but this work is for the time being of the project. People will come because there is kind of cash it's been distributed to them to be part of that, refreshment costs, so on and so forth. When the project ended, everything halas finished. But why we don't also understand the culture, understand the informal community ways of doing this kind of social contract and share? This is number one. Number two, for Muslim country, maybe also Georgia have something from Sudan. For Muslim country, we do have zakah and sadaqat. Zakah and sadaqat, normally people are paying this to poor people. So always we have this kind of identification of who is poor in our community, in our village, and we started to distribute money to them. And this is also not a part of that system. So I think it's really important to look for what is going on, what is the tradition, what is the system in place, and take it from there. Thank you.
Yeah.
Thanks so much. Barbara's joined in now and also commented about how international actors, I think whether they're humanitarian or development actors, are often very reluctant to engage with traditional organizations like clan-based organizations and so on. I wonder if you've got any examples that we can draw on of that being effective. of how we've engaged with a traditional mutual support system in ways that have helped us either identify better social protection and humanitarian beneficiaries, or whether it's enabled us to make sure that we're not duplicating and double dipping our coverage too much. Do we have any more positive examples of engaging with the kinds of traditional leadership type actors or community actors that create that nervousness among international funders? George or Abeer, any examples that you can think of, or is that reluctance on international actors just so overwhelming that it becomes impossible to do?
Unfortunately.
Okay. I'm just going to leave a few seconds for people to ask any final questions that they might have before we close. And while we're giving people a moment to add a question, I'd just like George and Abeer to maybe let us know, have a think about, what do we need to start doing differently? What do we need to keep doing that we're already doing? And what do we need to stop doing that we're doing right now? So start doing, keep doing, stop doing. And let's see if anybody's posted anything else. No, nothing at the moment. I wonder who would like to go first, George or Abeer, on start doing, keep doing, stop doing. Go ahead, Abeer.
I started doing understand the traditions and informal structure that could support social protection system, because by that you will also reduce this kind of relying on the international aid. You can also come up with ideas, especially what we witness now. Unfortunately, the cuts of fund will affect the social assistance in the country, like Yemen and others as well. To continue working is continue this kind of starting to work with national organization, like what I said in Yemen. They started to open their eyes to work with a social fund for development, and through the social fund for development, they are also trying to build the capacity of SWF. That's really good to start this kind of initiative. To stop working, stop dealing with national organization as a contractor, because by that we also lost the momentum of having a good civil society that can also support their own country. So maybe George can also, George, the floor is yours.
Thank you. And I think you have picked in two of mine, but just to add, in terms of what we need to start doing is to try and leverage on the potential, especially of grassroots and community structures in terms of their involvement in social protection. And I think in terms of what we need to stop doing, it is to defining localization only in terms of the funding. We need to start. We need to stop defining that. And also, like, we need to what we need to keep doing. There was one thing that was coming out very well from Sudan, that international actors have starting to recognize the role of some of these very much grassroots actors, and I think that's a very good example of that can be able to slip and be able to flow to others to recognize this role. So that is what I think in terms of what we need to start doing, keep doing, and also stop.
That's brilliant. I'm going to wrap it up there. If anybody would like to type into the chat box before we close there, start doing, keep doing, stop doing, we'd love to see them. But with that, I think what I'd like to do is thank our speaker today, Abeer, who's provided so many insights from Yemen, and to thank George for his contributions and helping us to take some of the discussion beyond Yemen and into a whole range of other countries. I think my big takeaway is not just service providers. And for me, to do that means looking at local organisations that we might be skeptical of because they don't follow the same procedures as us and so on. But it's time. If we're serious about localization or decentralization or devolution, then we've got to change the way that we go about this. So thank you, everybody. It's meant to be the start of a discussion, so do fill in the feedback so that we can hear what we got right, what you'd like to talk about next time, and so on. Thanks very much, everybody.